Now, generally, in chronic kidney disease, when you receive a patient in chronic kidney disease, you should know that there are certain elements that the patient should have taken. Is it clear? The patient should bring with. Is it clear? So the first element is that the patient should have a history. When the patient has a history of hyperpigmentation of the skin, is it clear? You have darkish discoloration of the skin. Is it clear? You must already think of uh, of a chronic kidney disease. When a patient presents with hyperpigmentation of the skin or dark discoloration of the skin, you must think of chronic kidney disease. Is it clear? The second, after the discoloration of the skin, you have the next one. We have our hyperpigmentation of the skin. You have to know that what in chronic kidney disease, the patient may also the hyperpigmentation is as a result of urochrome accumulation. Normally, urochrome is still produced in the same pathway like in another pathway like uric acid. Is it can normally supposed to be secreted by the kidneys. In the case of in a chronic renal failure, the urochrome is not going to be released. That is going to result to hyperpigmentation of the skin. The next thing that the patient of chronic kidney disease usually have is that they have uremic frost. Is it clear? And uremic frost just means that when you have whitish pellets which are located at the skin of the CKD patient, you have whitish pellets on the skin and the hairs of the CKD patient, which is just as a result of the urea crystals. Is it clear? Which are produced from sweating. Is it clear? You have urea crystals produced from sweating. Is it clear? Now, the third thing that the patient with CKD may have is pruritus. They are usually scratching their skin. Is it clear? They have pruritus. Why do they have pruritus? They have pruritus because uremia is an etiology of pruritus. That's why you need to know that there are three major etiologies of pruritus. It is either one uremia, two it is an increased level of histamines, or three it's an increased level of the bile acid. So these are the three major ones. In case of increased level of bile acid, you have any obstruction to the bile duct. In case of anything of histamine, can be anything which can be local or systemic. Local causes like scabies, local causes like varicella is going to cause an increased level of histamines, is equal to causes pruritus, and systemic causes like allergic response, and uremia like in the case of chronic kidney disease. Now, the fourth element that the patient with chronic kidney disease is going to present is going to be nocturia. Is it clear? Generally, we need to know that what in chronic kidney disease is also an association of the interstitial loss. Is it clear? That's why you need to know that the interstitium is the one that is going to prevent the fluids from being lost in the night. So that's why generally a chronic kidney disease is going to present with this as the first element. Is it clear? Nocturia is not always associated with an irritative symptom in a benign prostatic hyperplasia. Is it clear? Or in a urinary tract infection in the case of urology. So when your father has nocturia, after doing a DRE where you have not seen any element favorable for a benign prostatic hyperplasia, you must always do a creatinine in order to evaluate if the patient has a chronic kidney disease, and you have to evaluate for these other symptoms. Is it clear? Because nocturia may be either nephrologic or urologic. Nephrologic for chronic kidney disease, or urologic for a benign prostatic hyperplasia. Now, the next one, or a prostate cancer. The next one we have after nocturia, we have now the fifth one, we have muscle cramps. Is it clear? Muscle cramps because in the case of chronic kidney disease, one complication of chronic kidney disease is hypocalcemia. And then the last one we have body weakness. Is it clear? The patients in chronic kidney disease are usually weak for a long period of time. Is it clear? So you have body weakness for a long period of time just because they are anemic. Is it clear? So it's generally because they are anemic that they have this body weakness. So those are the different elements that you have to evaluate in patient with chronic kidney disease. Now, after seeing these elements, hyperpigmentation, so those this element of physical examination, those are the first elements, generally the first element that the patient with chronic kidney disease presents with. Now you have also the mechanisms. You say that generally when you have a glomerular disease, in case of chronic kidney disease, they are going to present with the different syndromes. Is it clear? You should try to evaluate in the issue of the physical examination for the nephrotic syndrome. You evaluate for the nephritic syndrome, you evaluate for the nephrotic ring syndrome and all those other elements. Now, after evaluating for all those elements, you need now to visualize that you have also complications. You have complications of acute kidney injury and chronic kidney disease. So we first start with the complication of acute kidney injury. The complication of acute kidney injury, the first one, you have fluid overload. Is it clear? And generally, the fluid overload in acute kidney injury, it is much more in the as I've just explained, it's much more going to be in the interstitial fluid and in the blood compartment. Is it clear? So you're going to have fluid overload. So that is going to be in the case of a pulmonary edema. And the presentation of pulmonary edema is that you are going to have one. You have a patient that is coughing, which is going to produce sputum that is foamy, associated with hemoptysis, is associated with hemoptysis or tinged with blood, and you have orthopnea, dyspnea, paroxysmal nocturnal dyspnea, and you have also on examinations of the chest, you have crepitations. Is it clear? So all that may make you think of a pulmonary edema. So you can have also other elements which are the edema of the edema of the kidney.